to our series of learning modules that focuses on the value of research in patient care. Our objective is to educate clinical staff on the scientific method and how to apply it to everyday clinical practice. In this, the first section of Module 1, we will explore what it means to be inquisitive and data-oriented as you care for your patients. As a clinician, have you ever wondered why you administer a certain procedure? Have you ever wondered if there could be other, more beneficial treatments for your patients? Do you ever consider options for better patient care based on what you have read or observed? Whenever you question the reasons for clinical procedures, you are contributing to your organization's overall enhancement of the patient experience. You are contributing to a spirit of inquiry embodied by an approach known as evidence-based practice, or EBP. For clinicians, EBP is a mindset. It is a way of perceiving and understanding our clinical environment. Through EBP, we question how we deliver care to our patients and discover new ways to improve patient care. In this module, we will promote research as the foundation of EBP and describe what constitutes good research. We'll review the Stanford EBP model. Identify the fundamental concepts in conducting a literature review. We'll illustrate the main components of a research article. We'll review a research checklist, and we'll discuss implications of the material in this learning module as they relate to clinical practice. Research, or systematic investigation, is the foundation of EBP. That is, research in all its forms will provide the evidence on which we base clinical decision-making. As such, in this learning module, we will promote the idea that the scientific method, as exemplified by research, is applied in a similar way to a range of research-related activities in a clinical setting, all for the purpose of optimizing patient care. The Stanford EBP model has 5 parts. The first is, I question what I'm doing. This means that we as clinicians take responsibility for understanding the rationale for practices we implement or observe in our environment. The second part is, I systematically investigate. That is, once we have inquired about the rationale for a given practice, we methodically compile relevant evidence through literature review or other types of observation. Next is, I measure an outcome. This may occur through data collection for a research-related project we have initiated or through systematic examination of other reported studies. The fourth part is, I make a decision. After we've gathered evidence, we decide whether such evidence is sufficient to justify clinical changes, whether it is inconclusive, or whether further investigation is warranted. Lastly, I disseminate. In other words, we share our findings and recommendations with colleagues and others involved in patient care. Federal guidelines define research as a systematic investigation, including research development, testing, and evaluation designed to develop or contribute to generalizable knowledge. Phrased more simply, research is careful study that is done to find and report new knowledge about something. But let's modify this further so that good research, empirical or data-based investigation, becomes careful and replicable study that is done with attention to sample size, analysis, and interpretation to find and responsibly report new knowledge about something. This also includes ensuring that your sample is representative of the population you wish to study. In Section 2 of this module, we will use a journal article to illustrate these key attributes of good research. But first, let's talk about accessing good research via literature review. Start by doing some preliminary reading on the broad topic area. This step is instrumental in refining your research question. For example, if the literature available on the topic is plentiful, you may consider narrowing your focus. Whereas if a lack of information exists, you may need to consider broadening your focus. Once you've refined your question, take a moment to brainstorm some of the words and phrases common to the topic. A thesaurus can be helpful in identifying related terms, synonyms, and acronyms to provide a robust list of search terms. Throughout your search, continue to add other pertinent terms to your list. You will also need to define the limits of your search and be consistent. Common limits include language, time frame, and publication type. Knowing where to look for material will be determined by your question and the limits you identify. Large periodical databases, academic and government websites, and professional organizations are all common starting places. The reference librarian at the library can be extremely helpful in pointing you in the right direction. An organized and systematic method of tracking your sources is essential to a successful literature search. Recording the complete reference information will make it easier to locate the source as well as create citations in any printed works you create. Tracking can be as simple as using note cards. Microsoft Word contains a citation function, and there are other software programs specifically designed for this task. Once you have conducted the literature search, each source must be evaluated for its strength in supporting your inquiry. You must determine the relevance of each source and ensure it is within your defined parameters. A quick way to accomplish this is by reading the article abstract, if it's available. The reputation of the publication is also important. For example, is it peer-reviewed? What is the purpose of the journal and the intended audience? Are there obvious conflicts of interest between the author, content, and/or publication that would cause the data to be suspect? In the next section, an annotated research article will be used to illustrate the components of an article and criteria for evaluating the content. But first, we'll ask you to reflect on what you've learned. Which part of the Stanford EBP model focuses on metrics? The part of the Stanford EBP model that focuses on metrics is I measure an outcome, which may involve literature review and/or data collection. Which attribute of good research is related to a study's participants? Such an attribute is the representativeness of your study sample, and often the size of the sample. True or false? It is advisable to use only one search engine when conducting a literature review. The answer is false. You should use as many relevant search engines as possible to gather comprehensive information on your clinical question. This education series is made possible by a generous gift from the Stanford University School of Nursing alumni in collaboration with Stanford Healthcare, Lucile Packard Children's Hospital, and Stanford Medicine. Congratulations! You have completed the first section of Module 1.